my name is Katie and I will be going over meaningful use. I'm going to start this presentation by taking you to our website, amazingcharts.com. On our website, you notice we have a meaningful use tab. It's very informative and holds a lot of good information. And it breaks down meaningful use into terms that is understandable. I'd like to start by showing you the tab Meaningful Use and going down to the criteria. This is where it breaks down what is required of meaningful use. There are 15 core requirements listed here. You must successfully meet all 15 of these core requirements. There are also 10 menu items. You get a bit more leeway with the menu items, and you have to meet 5 out of the 10. Amazing Charts has made it as easy as possible for you to be able to collect your meaningful use incentive. For starters, if you come up here to Edit, My Preferences, User Preferences, you're going to notice that there is a meaningful use notification. All items that are meaningful use required in Amazing Charts are going to be highlighted in teal. This is going to notify you that it is meaningful use required information. Now, if maybe you have something against the color teal, that's okay. You can go ahead and choose from these other 4 colors right here if you'd like. Or if you're a doc who's not looking to collect the meaningful use incentive or not eligible, you could also turn off those meaningful use notifications. In a patient's chart, right-click, pull demographics. The meaningful use recording starts in the demographics page. Race, ethnicity, and language preference. They're highlighted in teal, notifying you that they're meaningful use required fields. Now, anytime throughout Amazing Charts that you see a teal highlighted field, you can scroll your mouse over it and it will tell you why it is highlighted in teal. Required for meaningful use, core item number 7, to record race in 50% of your patients seen during reporting period. So you would use these drop-down boxes and come down and choose the race, ethnicity, and language preference for each of your patients. Once you've completed these 3 fields, you would go ahead and choose Update Information. Now, something I like to go over when I do my meaningful use presentations is the fact that it doesn't all fall on the provider's shoulders. Generally in offices, the front desk staff is in charge of filling out the patient's demographics. Everyone puts a little something into collecting this meaningful use information and something that they'll be in charge of. Under Most Recent Encounter, where you would start the note for the patient, File, New Note, you're going to notice right away that there are many teal fields throughout the patient's most recent encounter. Items like the vitals are highlighted in teal: height, weight, blood pressure, and BMI. Once again, scroll your mouse over any of these fields and it will tell you what core item it is and the measure that it needs to be met for. For instance, height and weight, core item number 8, for 50% of your patients 2 years and older seen during the reporting period, the height, the weight, and the blood pressure need to be entered for the patients. Now, once you enter the patient's height and weight, the BMI will automatically calculate, which is also a meaningful use requirement. And then you can go ahead and enter the patient's blood pressure. Under social history, you're going to notice that there is a select tobacco use. This is required for meaningful use, core item number 9, to check smoking status on 50% of your patients 13 years and older seen during the reporting period. So what you would do is click on this drop down right here and select the smoking status for these patients. Now, if a patient is below the age of 13, then this box will not even appear in teal. But for those patients 13 years and older, for 50% of them, you do need to record their smoking status. Allergies, you'll note that the allergies are highlighted in teal, and this is because it is a meaningful use requirement, core item number 6, to record allergies in 80% of your patients. Now, this means that you need to have at least one entry as structured data to maintain an active allergy list for 80% of your patients. Now, maybe Sally here, maybe she doesn't have any allergies, in which case you would come in here and check off this patient has no known allergies. That is structured data, and it is maintaining an active allergy list. You could also come in and choose from the common medication or common environmental, or just simply search through the database. Once you've added any allergies or reported that the patient has no known allergies, you could go ahead and confirm the list for each patient. Current medications, it's a different requirement, but the same measure as allergies. Double click on here. The idea to maintain an active med list for 80% of your patients. Now, if they don't take any medication, takes no meds. It's an option, it's structured data, and you can go ahead and choose that. If they do take medications, you can go ahead and just search through the database and add the medication to their med list. Also in the med list, you do actually find a menu item. Now, as I said, there are 10 menu items, and you can choose which 5 out of the 10 you want to run your report on. If Sally here were transferred into our care, if she were referred to us, and you check off this box right here, you're going to get a teal field down here that says Medication Reconciliation Complete. This means that you compared her past med list, the med list that came over with the referral, and her current med list. If you've done that, you can go ahead and check off this box right here. This is a menu item, and it needs to be done for 50% of transitions of care. Once you've completed this, you can go ahead and save those changes. So if you're a doctor who tends to get a lot of referrals, this may be a menu item you would want to complete. Another meaningful use requirement is to maintain an active diagnosis list for 80% of your patients, meaning that 80% of your patients need to have at least one entry in their problem list. Now for Sally here, you'll notice that in her problem list she has, a bunch of problems. But if Sally were a new patient and she didn't have a problem list with all these ICD-9 codes, we would have to add a code to her visit. Click Search Diagnosis Code, and you can go ahead and add in whatever code it is you would like. Script writing is also a very important part of meaningful use. It is a meaningful use requirement that 40% of your prescriptions are transmitted electronically. So let's go ahead and prescribe Sally some Nexium. We'll prepare that script. And also, it is a meaningful use requirement that the program has the functionality to be able to run drug-drug and drug allergy interaction checks. So if I come in here and I try to prescribe Sally some Lipitor on top of the Nexium I just prescribed her, you will notice we get a drug-drug interaction check that pops up saying that there is a moderate interaction between the two. Now you can double click on those rules or those interactions and read the interaction details. You could go ahead and override it for any reason, or you can simply just remove a medication that's causing the interaction and it will go away. In the Meaningful Use Wizard, which is the report that is run per provider, all the patients, how well you're doing collecting the meaningful use information, this item, the core criteria, is actually done by attestation. So you will be attesting to the fact, does your program have the functionality to be able to run these drug-drug and drug allergy interaction checks, and do you have them enabled? Version 6 of Amazing Charts, by default, they will be enabled and of course has the functionality to do so, like I just showed you there. Now once you go to prescribe the med, once you hit prescribe right there, this Nexium is going to count towards your denominator in the report, meaning this is one prescription that was prescribed. So if you come in here and you choose preview prescription and you print this out for Sally, it's going to lower your percentage because the Nexium went towards your denominator but not your numerator. Now if you come in here and you prescribe it to a pharmacy highlighted in yellow, pharmacies highlighted in yellow are fax only, meaning that it is leaving your computer electronically but being collected on their end via fax machine because they are not set up for e-prescribing. That also does not count towards your 40% of prescriptions transmitted electronically. So just keep in mind, try to prescribe 40% of your meds to these pharmacies that are not highlighted in yellow. Go ahead and choose transmit to pharmacy for that percentage to go up. Back to Sally's chart, another meaningful use core criteria is that you provide a printed CCD to 50% of your patient encounters. This is core item number 13. Now, to get to that CCD, there's actually two different ways to get to the same CCD that needs to be printed out and given to 50% of your patients. You can choose print instruction summary. This will be the instructions that, the instruction sheet that you will hand to the patient. Go ahead and choose preview. These are the instructions. This is not for meaningful use, the instructions. This is something separate, so you can close that out. And then this right here, the continuity of care document, is what counts for meaningful use. This will need to be printed out and given to 50% of your patient encounters. The other way to access a CCD is from a patient summary sheet. You would come down to here to print clinical summary, choose the visit that you want to print the encounter for, go ahead and choose preview, and it's the same form I had just brought up. Back to most recent encounter, you're going to find up in the right corner is our meaningful use checkpoint. It's one of the tools that we've implemented into the Amazing Chart system to make meaningful use easier. Before you sign off on a chart, you're always going to want to check your meaningful use checkpoint. Click right here. It will break it down, all of your core items and your menu items. It will let you know the items that are done by attestation, the items that don't pertain to the current visit, as well as the items you've collected. Most importantly, you can break it down to just the items that have not been entered yet. In our case, core number 12, we have not completed this measure yet for Sally. Now maybe you don't remember what core number 12 even means. That's fine. All you need to do is double click on it. This box will appear that will tell you what the objective is. And then you can just click Learn how to do this in Amazing Charts, and it will take you through the process step by step. Now for core item number 12, you will go to a patient summary sheet. Core item number 12 is required for meaningful use to export out a clinical summary to patients in 50% of their requests within 3 days. So that means if a patient says they want their CCD electronically, they want to collect it electronically, then you would need to complete this core item number 12. To complete it, you click on Clinical Summary. You choose which CCD you're exporting out. Choose the location you'd like to export it out to. Desktop is always a good choice, so you know you can find it. And then you would just go ahead and export out the CCD for the patient, so it will appear on your desktop. Now, if you're a provider who hasn't gotten any requests for an electronic copy of health records, your denominator in the report would be 0, your numerator in the report would be 0, then you would be excluded from this measure because you did not get any requests. Also under export, you have CCD, required for meaningful use, core item 14 and menu 8 to provide an electronic CCD for exchange clinical data and transfer of care in 50% of requests. Now what this means is that you are releasing Sally's records here electronically. To do so, you will need to click on the CCD, fill out the record release form, fill in which doctor these records are going to be going to, and under Reason for Request, you need to choose Transfer of Care. At this stage of meaningful use, this core criteria is done. They want you to test the program's functionality to be able to do this. Once you've filled in the information, you'll be brought to this page here where you can go ahead and select where you want to export it to, and then export out the CCD. And then you have PHR, and this is for patients who would like online access to their records. In this case, it is a menu item. It's not something that is required. As I said, you do have a bit more leeway on the menu items. So if you don't have any patients who have electronic access or online access to their records, this may not be a menu item you'd like to choose. But if you have a patient who does, and they request it, you can go ahead and choose the location you want it to go, as we did the earlier ones. And then you can choose settings. Choose the PHR the patient has the account with. And go ahead and export out that information for the patient. Now that we've finished up everything on Sally, well, I think we have, let's click and check our checkpoint to make sure there's nothing that we have not entered. We can close out of this and sign off on her chart, feeling pretty good about the fact that we hit on every meaningful use item in her counter that we could. Under Reports is where you're going to find the Meaningful Use Wizard. The Meaningful Use Wizard is the report that you run per provider that gives you the percentage of how well you're doing collecting the meaningful use information. Meaningful use is collected on all patients, not just Medicare or Medicaid patients. You first choose which program you're going to be collecting from, Medicare or Medicaid. Then the provider who you're running the report on. It's not per practice, it's per provider. You then have to choose your reporting period. Now, a reporting period needs to be 3 months before you can attest. But you can run this report, 1 month into using version 6 of Amazing Charts just to see how well you're doing. You can run it as often as you want to keep track of how well the doctor's doing collecting the meaningful use information. Something to keep in mind that's very important is this reporting period right here. You want to make sure it's set to the time that you started using version 6 and collecting meaningful use information. Things that were completed in version 5 are not going to count towards meaningful use. So you do need to try to be as sure as you can that this date is as accurate as possible as to when you started using version 6. You'll notice it's broken down into 4 tabs. We have our core criteria. All 15 of these core criteria are required. You cannot remove the check marks. The report is going to run on them. Something that I really enjoy about the Meaningful Use Wizard is the fact that you can use it as a tool. So you can just come in here and choose any criteria, double click on it, read its objective, and then learn how to do this in Amazing Charts. You then have the menu tab. There are 10 menu items. 5 out of the 10 you need to meet, and either 9 or 10 must be an option. You're going to want to take the time to come in here and read each of these menu items, how you complete it in Amazing Charts, and choose the report to be run on it if you know it's something you can meet in your practice. CQM required. This part gets a little confusing. There are these 3 core CQMs. The report is going to run on them no matter what. It's required to run on them, so you cannot remove these check marks. But let's just pretend you're a pediatrician and you're looking at this and you're saying, well, there's no way I'm going to be able to meet adult weight screenings and hypertension. You'll need to supplement the core CQMs you can't meet with alternate core CQMs, possibly childhood immunization and weight assessment and counseling for children and adolescents. If you know you aren't going to be able to meet any 3 of these core CQMs, then you'll have to choose all 3 alternate core CQMs. And of course, if you come to this page and you say, well, I'm going to have no problem, I have patients who meet all 3 of these, then you wouldn't need to choose any of the alternate core CQMs. CQM alternates, there are 18 to choose from. Take your time, come in here, read about them, and learn the criteria that goes into meeting these CQMs. We get a lot of calls saying it says 0, but I always check blood pressure. I always check blood pressure. Why does it say 0? Because there's more criteria that goes into the CQMs. For instance, this screening, this particular one, for controlling high blood pressure can only be met in patients with hypertension, so they have to have a diagnosis of 401. They need to be in the age group of 18 to 84, and they need to have at least one signed off visit during the reporting period. And most importantly, they need to have their most recent blood pressure measure be below 140/90. So although you may be checking blood pressure in every patient, you may not have a patient who meets that criteria yet. Something else, a lot of these CQMs you'll notice, for instance, this diabetes eye exam, when you click on Learn How to Do This in Amazing Charts, it says the patient needs to have 2 visits during the reporting period. So if you're running this report, maybe just 2 weeks into using version 6, you just want to see how well you're doing, chances are you're not going to have the same diabetes patient come in 2 times who meets all the criteria and has 2 signed off visits in a week or 2 weeks' time. So it may take a little bit longer to see those CQMs start populating and start collecting. Also, you want to keep in mind that although you may not do your billing through Amazing Charts, for many of the CQMs, in order for the patient encounter to be included in the meaningful use, you do need to use CPT codes and sometimes the relevant ICD-9 codes. So even though you may not, generally add CPT codes to your visits in Amazing Charts, for your CQMs to collect, you are going to want to start doing that. Just, choosing an office visit CPT code. Once you've set up your report and you feel comfortable, you can go ahead and run the report. Okay, and here it is. So of course my numbers are going to be much different than yours because this is a fake database, and right now I've seen 2 patients in the past month. I'm assuming your numbers are going to be a little bit different than mine. But you'll see how great the report is. Very self-explanatory. It gives you the numerator, the denominator, and then your percentage. You get a green check mark for criteria passed, a red X for criteria failed. For instance, my core item number 4, to transmit prescriptions electronically, I have prescribed 38 medications and 0 of them have gone electronically. So I'm not doing well on that at all. I'm doing a great job on maintaining active med lists and allergy lists. For my demographics, the 2 patients that I've seen in the reporting period, only 1 out of the 2 of them have I collected the correct demographics on. So I'm doing okay. I could be doing better. Something you'll notice is some of these say click to attest, like core item number 2, drug interaction check. Now, if you are saying to yourself, well, I don't feel comfortable attesting because I don't even really remember what that means, that's okay. You can come up here, click on it, choose core item number 2, read about it, and it says you must attest yes to having enabled the drug and drug allergy interaction checks. And you can feel comfortable saying, oh yeah, I do see those all the time. They are enabled, yes, and then you'll have the green check mark. You'll notice there are other click to attests. And that's what the report looks like. You have the option to go ahead and export it out so you can save it somewhere on your computer. You can print the report out. Maybe you want to run this report after 1 month of collecting meaningful use information, print out the report and hold an office meeting going over the criteria and what areas need to be worked on. Because as I stated in the beginning, it doesn't all fall on the provider's shoulders. Everyone's collecting the meaningful use information. And then the submission of info button, which brings you right back to where I started the webinar at our meaningful use tab at amazingcharts.com. Very helpful, and I recommend you all, go here and get some more great information on meaningful use. For any further questions on meaningful use, you can feel free to email me at Katie, Katie, @amazingcharts.com. I hope you all have a wonderful day.